about the rest of the children. Just in this community around us, there are in the region of 140,000 people. If you look up on the hillside, that is in Mpumalanga, what they call in Mpumalanga Township, and beyond that is Hammersdale, and they reckon somewhere in the region of 500 to 750,000 people living in that community alone. Going this side, you then, this is just rural, and here you will go for 2-3 kilometers and you won't find a single person, and then you'll just get to a cluster of houses. So our greatest challenge, believe it or not, the children, lies in that direction. These children have access to schools and clinics. The children that side have very little. And hence, we want to start looking at how can we provide for our kids, but at the same time, really start making a difference into the lives of so many more children. And one of the first things that we did was we bought this property. So it's a 200 hectare property. And the goal was obviously provide for the community and our children, but then also to look at sustainability, which we'll show you shortly. But this clinic was built entirely from funds out of the US. There is no clinic in this community. There is nothing. So the closest is the Mpumalanga, what they call the Community Health Centre, which we always work out in taxi fare because that's the reality for somebody, and that's 12 rand on a single trip. So if you're earning, if you've a granny and you're living on an old age pension, which is 700 rand a month, and you're talking about you've got, say, 3 trips or 4 trips to go through to the clinic because nothing happens very quickly around here. You know, you're talking almost 100 rand in the month you're going to be spending on. So what happens if people don't go? So in the African context here, there's no such thing as wellness in the sense of like well baby clinics. This doesn't happen. You generally don't do that kind of thing. In terms of preventative healthcare, almost doesn't exist. It's you only go to a doctor when you need to go to a doctor. So what services these communities at the moment are mobile, what they call mobile clinics, which is something which is a bit of a truck, and you have a nurse that comes on the back. The people wait at a defined position, and they come once or twice a month, and that way, especially the elderly can get their medication for blood pressure or diabetes, etc. The reality is they don't see a doctor. And the reality is that most of their conditions are not dealt with. And from an HIV/AIDS situation, especially with the children in this community, there are no ARVs available. We heard about 10 days ago that after 2 years of hard work and fighting against the system, we've just been approved as an ARV site. So for the first time, all the people in this community will actually have easy access to ARVs. At the moment, the only ARVs that are available to this area, especially this area looking that way, 40 kilometers away in Pietermaritzburg. And that is Edendale Hospital, one of the busiest hospitals in South Africa. So you can imagine the difference it's actually going to make to this community is going to be absolutely astounding. And just to the life of children, really, as a whole. So let's go through.